नमामि रामं रघुवंशनाथम्. I am Dr. S.K. Singh, ex-deputy CMO CCL. In this discussion, I want to discuss with you about benign hypertrophy of the prostate. It is a leading problem for male community. After the age of 50, we get frequent micturition in day and night. And what is that? The prostate gland has been increased and it is giving pressure, so that we have frequent micturition that may be cancerous, but usually it is benign. So its name is benign hypertrophy of the prostate. Prostate gland increases and it gives compression to the urinary pathway, creates obstruction. Sometimes a retention of the urine is found. Retention of urine means there is urine but it is not excreted. There is urine in the urinary bladder but it is not excreted, and hydronephrosis may occur. Serum creatinine may be increased. So treatment of benign hypertrophy of the prostate is must. To make more clear of the pathway of urine, we use the medicine 10 solution and a hormone that hormone is trying to lessen the amount of prostate. It wants to shorten the prostate, but 10 solution increases urine flow. It dilates the urinary pathway. What were the symptoms of benign hypertrophy of the prostate? Frequency. The patient will get urge of micturition very frequently. Second, it can throw the urine far off from the body as he has done in past. Steaming is lost and thinner. Steaming will be thinner. That will clearly indicates there is some obstruction, so that urine is not passed clearly. And sometimes we get urine retention, and when the patient gets urine retention, catheterization is needed. And doctors used to catheterize the patient and use the Foley's catheter so that the urine will come out spontaneously. So what were the symptoms? Urgency, frequency, sometimes hematuria, blood in the urine is also found. बार बार पेशाब का होना, पेशाब की फ्रीक्वेंसी का बढ़ जाना, पेशाब में खून पाया जाना, और जिस तरह से पेशेंट पहले जोर से पेशाब करने फेंक देता था वो नहीं हो पाता है, पेशाब का रुक जाना, ये सारे बेनाइन हाइपरट्रॉफी ऑफ द प्रोस्टेट के लक्षण होते हैं. एंड इफ यू गो थ्रू द अल्ट्रासोनोग्राफी वी विल गेट द वेट ऑफ द prostate is increased. Operation may be required. But medicine at a great extent, anti-hormonal tablet and tamsulosin works. Tamsulosin makes the urine pathway clear, and tablet of hormones will help to reduce the size. Finas tablet was used previously, but nowadays so many tablets has been researched out. So we must be careful about benign hypertrophy of the prostate. It may be converted into cancer, and we should be careful about. If urine flow will not be maintained, urine will not come out. Lodgement of the urine may cause hydronephrosis. Size of the kidney may be increased, and serum creatinine may be increased. Blood urea may be increased. So if such symptoms, if we see, we must have the knowledge of blood urea and serum creatinine. These are the parameters of our renal system to check and to know about that. So we first of all, we should recognize what are the symptoms. Frequency of urine is increased. Number one, अर्जेंसी, ऐसा लगेगा कि पेशाब कहीं धोती में नहीं हो जाए, पैंट में नहीं हो जाए. फ्रीक्वेंसी, अर्जेंसी, लॉस ऑफ स्ट्रीमिंग, दूर तक पेशाब नहीं जाएगा. चौथा, sometimes we may get hematuria, blood in the urine may be found. पांचवा, sometimes we get renal retention, वाटर रिटेंशन भी हो सकता है, यूरेथ्रा से पानी बाहर, पेशाब बाहर नहीं निकले. इस परिस्थिति को हमें ध्यान में रखे ही आगे बढ़ना है. और एक अच्छे फिजिशियन से मिल लेनी है. और अल्ट्रासोनोग्राफी, वी मस्ट हैव अल्ट्रासोनोग्राफी so that we could know from urinary bladder to ureter and total renal system and prostate. What is the weight of the prostate? How many times it is increased? If surgery is required, we should go towards that. If surgery is not required, medical care may help you for a long time. So, benign hypertrophy of prostate is a condition of age 50 to 60. If it comes earlier, it indicates there is no cancer. Maybe nothing hard and fast will present, but it may be in later ages, it may be cancerous. So, we must know about the benign hypertrophy of the prostate. That will a great help